COVID-19 vaccines, Pfizer-BioNTech vaccine. Today we will be talking about one of the COVID-19 vaccines, which is the Pfizer-BioNTech vaccine. We will be covering other vaccines in future videos to come, but we decided to start with the Pfizer-BioNTech vaccine because it is one of the first to be approved for injection into the general population by the Food and Drug Administration Agency. We promise to keep this video simple and to avoid unnecessary confusing medical terminology. This is not a promotional video for Pfizer and BioNTech, but it is an educational video so that some people who are interested about vaccines can get basic knowledge, and that basic knowledge can then become general knowledge. In our scope points, we will look at who Pfizer and BioNTech are, look at the injections and doses given, the duration of protection this vaccine offers, the effectiveness of Pfizer-BioNTech vaccine, how this vaccine performs against COVID-19 variants. We will touch briefly on phase 3 studies. We will list a few side effects of the vaccine. We will look at who should not get the vaccine, and we will look at special cases or special considerations. Who is Pfizer and who is BioNTech? Pfizer is an American corporation that has many branches in other countries. Pfizer specializes in researching and developing drugs, and also in biological technology and engineering. BioNTech is a German company that specializes in biological technology and engineering. These companies have partnered and developed a COVID-19 vaccine. The adequate dose for Pfizer vaccine is given via 2 injections, at least 21 days apart. Simply put, the first injection is given on day 1 and the second injection is given on day 22. The injections should not be interchanged with other vaccines. This means that both the first and the second injection should be from the same vaccine. So you must not get the first injection from Pfizer vaccine and get the second injection from another brand vaccine. Both the first and the second injection must come from the same brand vaccine in order to complete the dose. Although the FDA has approved the vaccine for persons 12 years and older, some countries use the minimum age of 16 for vaccination purposes. 7 days after being vaccinated with the Pfizer vaccine, the vaccine is fully effective and the person has got full immunity against COVID-19 infection. But the question is, how long will this protection last? The longest period that the Pfizer-BioNTech vaccine can protect a person against COVID-19 infection is unknown. It is currently known that protection can last a minimum of 6 months. There is no absolute certainty as to when a booster dose will be needed, but in April 2021, Pfizer advised that the people will likely need a booster dose within a period of 12 months after being fully vaccinated. The Pfizer vaccine is 95% effective after the dose is completed. That means after 2 injections have been given. Let us briefly and simplistically define effectiveness. Effectiveness is the vaccine's ability to prevent a COVID-19 infection so that the person does not develop symptoms and the person also tests negative for COVID-19 by tests done in the lab. However, a more favored definition of vaccine effectiveness is the vaccine's ability to prevent symptoms, the ability of a vaccine to prevent hospitalization, and the ability to prevent death from a COVID-19 infection. This graph has a simplistic approach to vaccine effectiveness. This graph shows the number of days after complete vaccination in other words, after the 2 injections have been given, and this is shown by the bottom horizontal axis. The percentage of vaccine effectiveness is measured by the left vertical axis. The increasing blue line shows the increasing vaccine effectiveness after the second injection has been given. The only thing I want to be noted in this graph is that full vaccine effectiveness is gained 7 days after the second injection has been given, and full vaccine effectiveness is 95%. Once again, no other vaccines must be taken between the 2 vaccination injections and for at least 7 days after the second injection has been given. How is the effectiveness of the Pfizer vaccine against the alarming COVID-19 variants or COVID-19 strains? The effectiveness of Pfizer vaccine is reduced against COVID-19 variants. The effectiveness is reduced to 93% against the UK variant, reduced to 88% against the Indian variant, and reduced to 75% against the South African variant. Phase 3 clinical trials. The Pfizer-BioNTech vaccine is still busy with its Phase 3 clinical study. The Food and Drug Administration Agency has approved this vaccine to be used in the general population on the 10th of December 2020. There were 44 volunteers enrolled in the study, ranging between the ages of 12 and 85. The volunteers were from the following countries: USA, Argentina, Brazil, and South Africa. Acceptable side effects after getting the injection include pain on the area where the injection was given. This side effect occurred in 84% of the volunteers. Tiredness, extreme tiredness, in 63% of the volunteers. Headaches occurred in 55% of the volunteers. Muscle pains occurred in 38% of the volunteers. Chills occurred in 32% of the volunteers. Joint pains occurred in 24% of the volunteers. Fever occurred in 14% of the volunteers. These side effects are more common and slightly more severe with a second injection, that is the injection given after 21 days. Patients can anticipate these side effects within 1 or 2 days after getting an injection. However, as already mentioned, these side effects are expected to go away on their own. These side effects are the body's normal response to a vaccine. Remember, a vaccine is also a foreign body. Who should not get the vaccine? The Pfizer-BioNTech vaccine should not be given to people who have had severe allergic reactions to the ingredients or one of the ingredients of the vaccine, or anyone who has had a serious allergic reaction to the first injection. Some examples of severe reactions include severe skin reactions, breathing problems, severe swelling of the face, and feeling like fainting and being lightheaded. This picture lists the ingredients that are in the Pfizer COVID-19 vaccine. You should not get the vaccine if you are allergic to any of these ingredients. When in doubt, consult your healthcare provider. Serious allergic responses to the Pfizer vaccines have been reported. Myocarditis and pericarditis have also been reported after receiving the Pfizer vaccine, especially after the second injection. Myocarditis is the swelling of the heart muscle, and pericarditis is the swelling of the fibrous layer or fibrous tissue that covers the heart. The risk of getting myocarditis or pericarditis is high in the first 7 days after getting the second dose, and it is higher in men younger than the ages of 40. These above mentioned conditions are rare, and they are rare, and the current conclusion is that the benefits of Pfizer vaccine outweigh the risks of getting these conditions that have been mentioned. If you are not feeling well after vaccination, consult your healthcare provider for a checkup if you are in doubt. Our special populations include pregnant women, breastfeeding women, children, the elderly, and those that have a weak immune system. There is not enough information regarding the risk of using the Pfizer vaccine during pregnancy. Please consult your gynecologist in this regard. There is not enough information regarding the risk of using vaccine during breastfeeding. Please consult with your healthcare provider in this regard. The Pfizer-BioNTech vaccine is approved for children between the ages of 12 to 18 years. There is no approval for children younger than the ages of 12 years. The Pfizer-BioNTech vaccine can be used in the elderly people 65 years and older. In patients with a weak immune system, the treating doctors may give a third injection depending on the assessment of the patient's case. Immunocompromised people may include cancer patients, organ transplant patients, and other conditions that weaken the immune system. My final remarks. The information regarding COVID-19 vaccine is changing rapidly, and the people need to keep up to date with the latest information. It is not surprising that some statements which have been made in this presentation and also have been made by other vaccine companies may be altered, retracted, or deleted. The effectiveness of one vaccine should not be compared to that of other vaccines, because this is misleading into believing that one vaccine is better than another. In future videos, I will explain vaccine effectiveness and why it is not advisable to compare vaccine effectiveness of one vaccine to that of another. That concludes our talk for today. I thank you for watching this video. Please let the people like, let the people share, and let the people subscribe to Dr. Siko's Room. Thank you.